Well, I'm a cancer epidemiologist, and so my concern has been with how can we do a better job of getting cancer outcomes at the population level, both in terms of preventing cancers, stopping them from happening in the first place, but also better treatment outcomes through making certain that the best treatments get to the right patients. And it was the Cancer Council that actually funded my very first major piece of PhD research. It was a very generous grant at the time, it was $62,000, and they were willing to invest that money in this young, enthusiastic, hopefully capable person, but I had no track record, hardly at all. And that faith that was put in me by the Cancer Council and the public of Western Australia, whose donations really supported that first work, have led to almost 40 years of work committed to trying to improve outcomes of cancer. So some of the most important areas that I've been involved in, certainly tobacco control is right up there. With other colleagues, I was responsible for Australia's very first official statistics describing the number of deaths and hospital illness episodes caused by tobacco in this country. And that method that we developed back in the 80s actually was subsequently adopted as the approach, the method right across Australia, and it's still used today, but also in many other parts of the world. And so the data linkage system has been used extensively now in Western Australia to study the outcomes of cancer treatment patterns and to improve those outcomes. One of the most conspicuous examples of this in practice has been the way that we've been able to show that people living in regional Western Australia do not experience the same outcomes as those living in metropolitan Perth. We're very determined to do something about this, and the Cancer Council, in collaboration with the A.H. Crawford Society, has led a major funding initiative that has enabled a research team led by myself and Professor John Emery and other researchers to really start tackling this problem in regional WA through a major intervention trial. It's happening right now. In fact, here I am, I'm actually retiring soon, and my very last major piece of cancer research work in Western Australia is this intervention trial to improve cancer outcomes in the bush. And guess what? It's being supported by the Cancer Council. I would suggest that if you would like some evidence of why it's important to support the next generation of cancer researchers in WA, I provide an example. When I think back of how the Cancer Council, with donations from the public, enabled my career to actually get started. And here I am almost 40 years later, over 500 publications, $63 million worth of research grants. The work that I have performed and published has been cited over 11,000 times around the world. It's become a basis for the scientific underpinnings of advocacy efforts for cancer research, and all that began because the Cancer Council was willing to take a risk on me as a young person starting my career.